Councillor Martin Moran-Bryant.
Thank you, Chair. Well, I was very fortunate, actually, because I was able to have a briefing with Barbara Rooney the other day to ask some questions that sort of came across the whole scope of the service, because, as you say, the way we set our committees isn't necessarily the best for reviewing something like this. And one of the things that we discussed, or I raised, was about some of the specialist sort of services that you offer. So when you're looking at recruitment, one of the things I asked about was the lactation consultants as an alternative for those mothers who very specifically need that kind of help, rather than necessarily just employing people who are going to do all of the whole gamut of health visiting. Are you able to kind of separate out, maybe not just looking at people who are quite generalist, but just maybe use some of those more specialist people to help fill some of that gap that you have? Is that possible?
Yeah, it's entirely possible. And I think something the paper echoes and the model as well. It's agile all the time. We've had to flex our offers based on what the needs of children and families are. And in response to some of the recruitment question there, it's just about if we can't get the staff that ideally or traditionally have been used, then definitely we'd look at other ideas. So really welcome your views if you've got some ideas for us that we might want to consider.
Yeah, thank you, Simon. If I can just sort of come back, and again, I know that we discussed this last week. I think I always feel like I have to sort of wade in with the voice of realism as a commissioner, and I think there's never a shortage of ideas and enthusiasm for being able to support specialist areas, etc. I think what we have to, however, sort of keep in mind is that we currently are in a situation where our health visitors carry sort of caseload responsibility for approximately 500 families, and at any one time, and again, these are, it shifts from sort of month to month, but at any one time, something in the region of 18 of those families will be families where they're deemed to require that UPP provision, that more intensive support. So I think we do have to sort of balance what the, and the service provider, and I do have to say this, that CCS are incredibly flexible and adaptable, but I think we also have to recognise that the Healthy Child programme is, as I said at the beginning, it's every child's entitlement at some level. So it is a constant balancing act, and that's taking recruitment issues out of the picture. So hence the additional fixed-term funding is a real opportunity to strengthen provision and perhaps look at some of that kind of flexibility. But I know Philip doesn't mind me saying, we came up with some really good ideas that I think will be quite exciting to kind of share back with CCS. So really good. Thank you.
Are there any further questions? I had a question. What is Plan C, in the sense that if you struggle with recruitment and you don't manage to recruit, is Plan C then reverting back to Plan A, which means that for the universal service, not that many women and babies will get those face-to-face visits, and what are the implications of that?
So Plan A is always there in the background per se. So Plan A is as is now, and B is where we want to get to. We reached out to 1,200 families, in excess of 1,200 families, to get to Plan B, to identify which contacts are ideal face-to-face and which are those which can be done in other mediums. So we're more than happy to go around that loop, and as a service we're very much fed by what children and families want, matched to what we can provide. So I think honest, open conversations would be the next step. The second thing is also looking into skill mix. So as we've discussed before, and as we helpfully have identified just now, there are certain elements of the Healthy Child programme we might be able to deliver with different skill mix and different professional staff. So if that's the case, we can go back and again refresh and review what status we're at.
Thank you. Yes, just to add as well, we are obviously looking at our recruitment and retention packages within CCS and ensuring we're offering the best and the right deal for the skilled staff that we need to in place to undertake this programme going forward. And the other thing we are doing is obviously talking to our education providers. You have to undertake a certain course to become a school nurse or a health visitor, and actually talking to our colleagues in education, higher education, around some flexibility, around the training and so forth has also been one of our options in order to bring the staff through and get people trained.
Thank you. Councillor Martin Moran Bryant.
Thank you very much.
I'll get there.
That's fine. Thank you. One of the things that I have been sort of discussing with mums who have got young children at the moment is around the value of social media and around buddy schemes. So when I saw this model of provision, I was really pleased to see the breastfeeding support contact with the baby buddy or volunteer. I did mention this to Barbara before, that actually, despite sort of being in the category of having had a baby recently, I wasn't contacted by them, but it's something that I really do support, because I think that if we are able to take some of the sort of the more everyday questions away from health visitors, and mums and parents and families have that peer support. So there's an amazing Facebook group called Mums and Mums to Be 2020, and for me that has made it so much easier having my second child as opposed to my first, because any time of day or night you can post on there, my child is doing this, is this normal? You can maybe have a bit of a laugh about it with other families. You can there are a couple of midwives and doctors on there who are doing it sort of not in an official capacity, but it can offer reassurance. And then if everyone's like, actually maybe that isn't right, everyone was quite sensible and says, contact your health visitor, contact the GP. So I really do feel that peer support is actually able to take away a lot of sort of maybe the more mundane, if you like, work from the health visitors, and then actually enable them to focus on the cases which do need a lot more attention. So I was really glad to see that baby buddy scheme. I'd really like to know actually if that breastfeeding support contact could actually be moved to earlier, because 4 weeks is quite late in the breastfeeding process. By that time, if you're having struggles, you may well have gone on to formula, or if you're able to afford to, you might move to a lactation consultant, or you just may have sort of felt that you had to abandon breastfeeding, even though that's something that you didn't want to do, and that can be very detrimental to mental health. So I'd like to know if that could be moved. I'd like to know if that works with other organisations such as La Leche League or Breastfeeding Network or Milk Mentors. And also I'd like to know if the service is able to maybe move to a bit more of a kind of digital model, much more on Facebook and Instagram and that sort of thing, because that's where mums and families and parents talk to each other, with just a little bit of input from health visitors to, again, just take away some of that everyday pressure and then enable the health visitors to support those families that need it much more. Is that something that the service is able to do?
Kate.
Thank you very much for your question. There are some things there that I will need to take back to the service to clarify. But what I will say is that our breastfeeding model is based on the World Health Organization programme for breastfeeding, and we are awarded bronze, silver and gold medals as part of that process. And we've got services, as you're probably aware, Cambridge Community Services has a wide geography from Norfolk down to Bedford and Luton. So, and we've got services both at silver level and gold across our patch. So my reckoning is that actually the 4 weeks is part of the World Health Organization programme. So I will take your query back and I will respond, of course. I think as well with the breastfeeding buddies, so we've piloted in Norfolk more of a virtual response using Facebook and a more interactive web page for parents, new mums, new dads, carers to access, not just around breastfeeding, but around that younger age group for children and babies. And that's been developed with parents in Norfolk and is now being fully flown out up there. And why I'm mentioning Norfolk is actually that best practice is shifting down Cambridge Community Services and our breastfeeding support group, our breastfeeding leads within Bedford and within Luton are now looking at that webpage and pulling everything they can from that to try and make us a little bit more interactive down here, using some of that media resource that many people now utilise. They don't necessarily phone the GP anymore. They might, as you say, join a Facebook group or go onto Twitter or go onto Instagram. So we're trying to move with the times, but in consultation with our parents, those that know what's best for them. So, as I say, I'll take the 4-week contact back, and I'll certainly come back to the council on that. But the other part is we are slowly moving forward with that social media piece.
Just for clarification, is that the Children's Community Health Hub I saw mentioned somewhere? Or is that something completely different? Because it feels like something that isn't kind of really very well advertised, but I'm not sure that's for parents or not.
Yeah, absolutely is. So the Children's Health Hub is separate but linked. So it's a universal access point, basically, where children and families can link in with support such as breastfeeding or anything along that Healthy Child Programme pathway.
And do a lot of parents consult that or engage with that hub? Yeah.
Absolutely, yeah, and we've also got quite a lot of social media coverage out there about the Health Hub, and it's evolving.
Thank you. Any further questions? Martin?
Not so much a question, more of a comment, just to say that, to go back to what we were saying, where there's crossover with families, it can't be underestimated what critical role in the safeguarding partnership health visitors and school nurses play. I think without their input and their continued focus on those families that are accessing UPP services, despite the high level of increase in demand, the safeguarding system, they're such an integral part of that, keeping children safe, that it can't be underestimated. So I really want to say thank you and grateful for that part of the focus. And I have my sympathy with the other pressures, but I don't want that to go unstated.
Thank you. Any further comments or questions? Councillor Martin Moran-Bryan, go ahead.
Thank you, Chair. I hope that's okay. Yeah, I'm really looking forward to hearing more about social media in future, because that's basically where we all spend all of our time, quite frankly, or I do anyway. The other question I have, and I think it follows on from Martin's comment, is about the role that the GPs are playing. So obviously there's the sort of 6 to 8 week check the GPs do. I'm just wondering how they are feeding into the UPP scenario. Are they making referrals across to you, and is that a really good relationship?
So yeah, it's a good relationship, and something I was going to discuss, and it wraps around your question there, is about the system offer. So wider than this programme, we've obviously got lots of system partners involved and we engage with. So we have link workers within primary care who work with respective GPs, and we're also linking across with them to check if certain checks have been done. Unfortunately, as Barbara referenced earlier, we haven't got the resource to check absolutely every avenue, but the relationships are healthy and we do have a lot of comms with them.
Okay, any further questions? Is that a no? Okay,